Our passion didn't start with the mouth. It started with people, with the well-being of the profession, and if you're like me, maybe a little bit of your nerdiness in all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on the tech, and listen to your gut while you take care of teeth. And let's get honest, the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Hello, everyone. Welcome to the Dental Handoff. I am your hostess, Dr. Kelly Tanner, RDH. And today I have with me a long-standing friend of mine, Angeline Richwine. Hi, Angela. I'm so happy to have you on today.
Thank you for having me.
Yeah, so I have known Angela for 20 plus years. We knew, so I told her, I said, I'm gonna tell what I think our story is, and I'm gonna have you tell what you think that you remember our story is. So I remember Angela from the Virginia Dental Hygienists Association. She lives in Virginia with me. And I think that we were at an event. And I think, but though before that, though, we were at meetings together with the association, and we would run each other at the events. And you guys know those friends where it's like, you don't have to even see them. And you're just like, you pick up right where you leave off. And Angela's always been one of those folks in my life, and just so grateful for her. Angela, how do you remember it?
Oh gosh, Kelly, one specific memory is that you blew me away with your intelligence. And it was during one of our lunch, everything that you said, yes. But I remember sitting at one of our lunch breakouts, and I was sitting at the table, and I don't even know what I was doing or who I was sitting with. But then you came over and you just sat there and blah, 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 blah. And we were just chit-chatting. And then I was just like, you had to leave. We stayed and we chatted for maybe 10, 15 minutes. And then you got up and left. And I thought, she is just so special. She is a gem. She is so intelligent. She is on a mission. She is someone who I know I'm going to love forever. And she is always going to be a part of my life, no matter where I go.
Oh, that's so heartfelt. That makes my heart happy. This is great. Thank you. No, I remember like sitting and having an intensive conversation because it was like your energy was so similar. But I always make it a mission to sit next to people I don't know or I haven't met when I'm at those meetings. So that way I can make people feel welcome, love on people. And I think that's how you came into my life. So just a quick little blip. I haven't seen Angela in forever. And recently I was talking to her in a few other ways. And then she showed up at a meeting from another mutual person I had just met in a meeting in Fredericksburg. And I'm like, nuh-uh, I have to talk to you like 2 or 3 times in 1 week. It's been 20 years or however long it's been. So just so glad you're back in my life. And I wanted to tell people about the good work that you're doing because I'm so fascinated by it and just by your path. Tell us a little bit about your journey and why dental hygiene.
Right. Thank you. Oh gosh. So let's see. I've been in the dental field for 28 years now, and I started up in Reston, Northern Virginia. And I was working at a restaurant, putting myself through college. And one of my coworkers said, Angela, my God, every single weekend, you always have dental questions for me. Why don't you just come and work at my office? We'll train you there. So I was 19 and I started working in orthodontics. So I worked in orthodontics for about 6 years. 4 years into it, one of my dental hygiene mentors, Kathy Berard, she would come down into our ortho bay to see her handicap patients because we always had this open chair where wheelchairs and such could fit. So she would come down and frequently, and she would just say, over time, Angela, I don't say this to everybody, but you need to go to hygiene school. You really talk a lot. I'm like, oh, okay, here we go. So thank you, Kathy. So she just heard the passion in my voice when I would explain things to the patient. She would listen to how I would treat them and talk to them and such. So anyhow, I went to hygiene school and then got married into the military, the Marine Corps, went out to California, took my boards out there, became a hygienist out there, and also learned how to, I took the course to give local anesthesia and administer nitrous oxide oxygen sedation. So we were out there for a few years and moved back to Northern Virginia. There is when Kathy found me again and said, Angela, we're going to bring you onto the board. You're going to sit on the political action. You're going to be the chair for the political action committee. And we're going to bring local anesthesia to Virginia. Let's do this. Okay, great. So Kelly, that's where I met you, is through the VDHA. And my passion for dental hygiene has really grown so much since being exposed to lobbying and the political aspect of moving forward in the advancements in what dental hygienists can do for our state, and not only, or in our state, but not only in our state, but nationwide. And it's just so important to be a member of your professional, or just have these professional memberships so that you can contribute to improving your career, your field, and just helping everybody grow and learn and share. So from dental hygiene and moving from state to state with the Marine Corps, my husband retired from the Marine Corps, in 2011. And then from North Carolina, we moved back to Virginia. So now we are in Central Virginia. And I was, but during all of our time away, you have to keep up with your licensure, keep it active. So you have to continue taking all of your continuing education courses and units and such. I would always travel back to Northern Virginia, or to Virginia, wherever the Virginia Dental Hygienist Association was hosting their annual session, which is, I think it's usually in March, the end of March. And during that weekend, you can get all of your annual CEUs just in that one weekend, and it's extended. So anyhow, I would always run into everybody, and it was always so nice to see coworkers and friends and professional peers, just peers, and be in the unit together again. During one of our, probably maybe 18 years ago, I took a course, and it was only a quick 30-minute introduction to what orofacial myology is, orofacial myofunctional therapy. And it really hit me. It really rested deep in my mind, and I think just in my soul. So over the last 15 plus years, oh my goodness, it must be, gosh, I feel like it's even longer than that now, but I learned enough in that course that triggered me to wanting to learn more. So the internet wasn't bad back then, but we had small children, and I was moving and shifting and getting through deployments and having another kid. And so there was just one thing after the other. And my focus wasn't on me, it was on the family, which it still is, but I throw myself in there from time to time. And myofunctional therapy, I learned a lot about, and I knew one day I was going to be a part of that field. And what orofacial myofunctional therapy, not just being a big mouthful of words, what it is oral, the mouth, facial, of course, the face, myofunctional, myo meaning muscle, functional is the function of the muscle. So we work mostly with the head and the neck about the movements and function of the muscles. So I'm going to just stand up for a second, show you my shirt, because it's really what it comes down to is, where's your tongue?
Love that.
I knew I could just keep talking.
Yes.
But I'm going to pause for a moment if you have any questions.
Yeah. So you moved around, you had this tidbit of information that just dropped into you that resonated from something that someone said, which I always find so interesting, because that's the importance of telling our story and telling our why, and sharing what it is that we know, because it's in those moments that we share that it can resonate with someone so deeply. And it's the ripple effect of how people can keep sharing and growing. So with that, it's you latched onto this because you felt that this was a big change, a big shift in the way that you could care for your patients. And once you see something like this, you can't unsee it, right?
That's the truth.
So tell us more about this. Like, what was your next step? How did it grow within you? And like, where are you now with it?
Yes. All right. So my why. I'll start with my why. So my why is my children. So the speaker at this seminar was talking about some things to look for and some signs and some symptoms. And I just thought, okay, this is interesting because I just had a baby, my first, and I just had, all of these different types of problems. I had a lot of problems with my firstborn. 23-hour labor, lots and lots of pushing, exhausting. They had to use the forceps to pull him out, and it was pretty traumatic. And anesthesia wore off, and boy, that's what make women strong, right? So we had a horrible time latching to breastfeed and feeding throughout his life, depression. We had to go through a lot of counseling starting at age 5. We had a lot of problems. Well, it didn't dawn on me or my mother because she's a nurse and she stayed with me for a little bit. She's like, no, you got this. He'll grow out of it. And just like all the other physicians and the IBCLC, the lactation consultants, they're like, no, you'll get through it. It'll be fine. This may be a little graphic for some people, but it's truthful. It's the bleeding cracked nipples and the mastitis and the pain and the lack of sleep for both the baby and for myself. And little by little, I think that he's my why. So I'll just wrap it up. He's my why. And I don't want other moms to have to go through what I went through. So what can I do to help? What can I do? I can share my story, yes, but I have to do something further. So in that webinar, I kept on coming back to certain things that would trigger, okay, I need to read more about this. I need to learn more. And there's just so much information. Google Scholar has amazing research there that will show what a tongue tie can do to the entire body. Everything is connected. Everything is connected. So what I do now is I work hygiene 1 day a week, and it's only for 4 hours. And I just can't get out of it yet because I just still find passion in it. So I'm just dabbling in it. And I'm so thankful for my office where I work that they allow me just to come in for such a short time. But what I do now is I'm an orofacial myofunctional therapist. And I work with patients, clients, the term is used interchangeably, working with myofunctional disorders. And there's so many to think about. But it's characterized with the dysfunction, and it can interfere with normal growth and development. And it affects breathing and speech and chewing and swallowing and your oral rest posture. So just like my t-shirt, where's your tongue? Your tongue should always be in your palate, always. It's your natural orthodontic appliance. And when a baby is born, that tongue, we are born obligate nose breathers, which means we should be breathing through our nose all the time. So if your mouth is open and you're breathing through your mouth, close it. Close it. If you see your baby doing, breathing, stick your thumb right underneath their jaw and push that tongue up, and that tongue should go to the roof of their mouth. But sometimes if there is a tethered oral tissue, or a restriction, then it can hold the tongue down and it may not go up into the palate. And one thing, it's a trickle effect. I can get into that, I suppose, later. But to go back to the why, that's my son. He's my why.
So what you explained like how he progressed and that you all went through counseling. Was all that related to that in some way?
Yeah.
To the tongue tie? You want to tell us more about that?
Yeah, we had him actually. We went to the ENT because he was ear infection after ear infection. His anatomy was just, he was growing long. He was growing long because his tongue was never resting up. It was never resting on his palate, in his palate. And he was always a mouth breather. His mouth was always open and long, just a long-faced kid. And it just kills me in hindsight because he just graduated high school. And so I put together this huge collage of photos, and almost every single photo I see him with his mouth open. And all I can think of is, had I known then what I know now. And now I'm having a brain fart because now I want to say so much more. But everything is related. And now research shows us this. We went through, a sleep study. The ENT said, oh no, his tonsils look fine. Well, I do recall looking, and they weren't quite kissing each other, but they were pretty enlarged. But let's go ahead and do a sleep study. Okay. So we went in and did this sleep study, and it showed that he had mild sleep apnea. Mild. So let's just go ahead and say he'll grow out of it. Let's not do anything about it. Let's keep the tonsils in. Okay, fine. I'm a proponent of keeping body parts in, and natural healing. The tonsils are, and anyway. So we just thought, okay, well, we'll let him grow out of it. Well, then there's depression involved because he's not getting any sleep. Because when you breathe through your nose rather than your nose has a filter. Your mouth doesn't. So breathing through your mouth, you're not getting that type of good oxygen to get into the bloodstream. When you breathe through your nose creates this natural gas, or breathing in, and it's called nitric oxide. I'm not a breathing specialist, so I'm not going to go into detail about that, but it creates this natural gas in your body, and you inhale into the lower third of your lungs, works with your parasympathetic system, and you just have better blood flow. It's sympathetic versus parasympathetic. You have your fight or flight, and then you have, your rest and digest. When you breathe through your nose, your tongue is up, you have a very calming effect, and you're getting good oxygen. Your body has optimal health when you're in a rest and digest state. But mouth breathers are in the sympathetic state where you're in that fight or flight. You are, you're always on edge. You're just not calmed. Eating is a big thing as well. So he was a very picky eater. He only wanted soft foods. He didn't want anything that he had to work hard to chew. He had, it was just easier with a tongue tie to not have to shift the foods around and chew in his mouth. He was more along the lines of just wanting to swallow the food. Anything soft, that's the easiest thing. If it melted in the mouth, great. Easy to swallow, easy to digest. And we need our muscles of mastication to always move. We need the face to work all of your muscles in order to have proper development and growth and good swallow pattern.
Yeah.
But everything's connected.
So how would a dental professional recognize, what are some things that we can do just to say, oh, this may be an issue when a patient's in our chair? Or even if you're looking at someone, then we have to be in our chair, because I know that you could probably see it from 100 miles away now, right?
Yes, it's a blessing and a curse. And I
Right.
love both. Some of the signs, that you can look for are lips apart, like when they're just watching TV, or, a lot of kids are on their devices now. You want to look for swallow pattern. When they swallow, does the tongue come forward? Do the teeth come together? Or do the teeth come together in the back, or are the front teeth separated? That's called an open bite. Is there a lisp? Are there speech disorders? Again, I'm a hygienist and a myofunctional therapist. I'm not a speech therapist, so I can't really, I can't diagnose or anything like that. But, when you speak to someone, you can watch where the tongue goes. And if it comes forward, that's just not normal. It's kind of common, but it's not normal. Drooling. Is there a lot of drooling? Is there a thumb sucking or digit sucking? Or is the pacifier being used past 12 months of age? The tongue thrust, mouth breathing. That's the biggest thing, is the mouth breathing. Now, lips can be separated and the tongue can be up, But if there's no nasal breathing, then there's just going to be other types. There's something else going on. In the dental field, in the dental chair, one of the main things that you can look for, even ENTs and speech and language pathologists, OTs, PTs, IBCLCs, you can look for is a scalloped border of the tongue. So it's just like, it looks like the teeth embedded, like the teeth marks on the side of your tongue. And that just shows that the tongue is not resting properly. There's not enough space in your mouth. If you feel like that your tongue is too big for your mouth, that's not the case. It's just that the mouth is too small for your tongue. Your tongue is supposed to be that size, but we just need to make the mouth that size.
So how do we do that?
Well, from the very beginning. So if you have the knowledge to make sure that the tongue is up on the roof of the mouth for a baby. If not, then if you see that the tongue is low resting often, then, go see your pediatrician and go see an ENT, go see your dentist, speech and language pathologist who's trained in myofunctional therapy can immediately tell if there's a tongue tie or a tethered oral tissue or a restriction of some sort. But mouth breathing is one of the number one signs. Venous pooling. I didn't sleep well last night, so I really have these, venous pooling is the dark bags underneath the eyes. That's also another sign that you can look for. Dental professionals, especially scalloped border of the tongue. Gaggers. Oh my gosh, when you take x-rays, a lot of those who, when you put the sensors in the mouth, if they're a gagger, chances are that they may have a restriction, a tethered restriction.
Makes sense.
The tongue is just not able to move anywhere. So it's that fight or flight, and you're not sticking that in my mouth, and that tongue is just so big, and it's like, yeah, get that thing out.
So you correct it with sometimes through revision of the oral tissues. Also, orthodontics is another way to revise the arch too. Correct?
Yes, thank you for leading me into that. I meant to say that too.
No, it's okay.
So myofunctional therapists, what we do is we want to find the root cause. We want to find the why. And why the mouth breathing? Why is their mouth breathing? Why is there snoring? Why is there picky eating? Why is there a speech problem? That's when we refer to as a speech and language pathologist, but we refer to dentists, ENTs. We want to see if there's nasal patency. Can they breathe through both nostrils? We refer to orthodontists. We want to have expansion on the palate. If there is expansion on the palate, then we want that tongue to fit up in there. And if the tongue doesn't fit, we need to make room up there. So an orthodontist plays a very big role in what we do. We want to make space in the mouth.
That's awesome. And so I know I did 100 hours of CE in functional orthodontics back when I was a baby hygienist. And we learned so much about the airway, the gait. I mean, this has been 25 years ago, even before it was a thing, it's like a well thought of thing. And people are like, why are you looking at all that? That's weird. And I'm like, no, it's all connected. And I know that the premise is if you can recognize it and treat it earlier, it's obviously better for lifespan, better for health outcomes, a lot better for a lot of different things. But how does it, so what I hear you saying, kind of like some things that you're saying, a scallop tongue position, how the teeth come together when they're in your chair. And then is there anything else? You said also to like dark circles underneath the eyes as well.
Yeah. Another thing to look for is that forward head resting posture. So if there's a lot of slouching, going on, and it's the teenage syndrome, it's the teenage cell phone syndrome kind of thing. If their head is forward, they're trying to open up their airway, because if they have maybe a lower jaw that's pushed back, words for that, but for those who are unfamiliar with those, if the jaw is set backward, then it just blocks the airway. And if they're blocking the airway, then they tend to lean forward so that they can open that airway so that they can breathe better. And when that happens, the mouth comes open as well. And then, has anybody seen that movie, Napoleon Dynamite?
Yes. Doesn't it drive you crazy?
Right.
So yeah.
And unfortunately, we just have so many people who have that. And it's unfortunate, the forward rolled shoulders, the slouching, snoring. Snoring is such a big deal. It's just the lack of air that's being entered into the body. There's an obstruction. There's something else going on. So we have to really pay attention to what our bodies are telling us.
Yeah. And something I put together the other day, my children and I went to the beach a few weeks ago, and I noticed that a lot of swimmers have that elongated face, and surfers too, for whatever, because they're constantly gasping for air to come up and breathe, because it's not their natural tendency, because they usually have this closed. So have you ever thought about that?
Yeah. Oh my gosh. Michael Phelps is just a great example. He is just one of the most amazing, Olympic decorated Olympian. And, you look at Michael Phelps and he has that long face, the narrow palate, the skewed by malocclusion. And I mean, just look at how much he's accomplished. But, we often wonder, in our field, of course, we can look at someone and say, oh yeah, this, and we can, really assess disorders. And we think, gosh, how much better could he have been if he had that open airway? But swimmers, for sure, big athletes, actually, it would be a very good thing to be able to teach these athletes proper breathing. It just, and again, I'm not a breathing specialist, but I'll throw in a resource, Buteyko breathing, Wim Hof breathing, a lot of these different types of yoga breathing exercises that can be done. Breathing through your nose, when it creates that nitric oxide and it goes, into the bloodstream and through your body, your endurance, you can last longer and you can run further. And if you control your breathing and you control everything that's happening inside of your body, nasal breathing can really go a long way. There's not enough time to get into it. And again, I'm not a breathing specialist.
No, that's so interesting though, because it's all, I've known for a long time that's all related, but it's cool to have you tell us all about it. So, how did people learn more, and how can they reach out to you if they wanted to say, hey, Angela, I want to know more from you or someone you know?
Sure. Yeah. So I have my own business. It's called Central Virginia OMT. The website is just .com. And my website is a work in progress. And but I also volunteer for Airway Circle. Airway Circle it's a resource and educational center for professionals, airway professionals, dental, goodness, everybody, IBCLCs, PTs, OTs, speech and language pathologists, MDs, everybody, dentists. But it's a platform for airway professionals to come together and learn, share, collaborate, grow. There's an online directory for parents who can also go on there. And from there, you can look at the directory. And actually, whomever is listening to this, professional, healthcare professional or non-healthcare professional, if you are a healthcare professional, then you can go to airwaycircle.com and you can join the directory for free. There is a membership, and the membership does allow you access to all of the Zoom sessions, the educational material, all of the, every Thursday evening, we have a Zoom from 8 to 9 p.m. And it's so educational. Everything, we have every platform of healthcare on there. And we do have other courses and classes that we take and offer on the weekends once a month. But for parents especially, we have all these professionals on there and their professions listed. So it's just an informative location for everyone to go see and can benefit from.
I love the collaboration and that leadership also aspect of it. This is a lot of what the Dental Handoff is about too, is because you stepped up to be a leader in a way that you saw that it was important. And now to have resources that support this. I mean, if you have to make a referral, it's really important to know who to refer to, because some other providers may say, no, it's not a problem. But then some are like, oh yeah, this is a problem. So that calibration of that understanding of when to treat, when not to treat is important. But that educational aspect and becoming a member, I think is a critical piece of it, because you could be, just like with anything, you could tell your patient something that you're seeing something they need a referral for. But then when they refer, it's like, no, we'll just watch it. And it's like, oh, you can, so with everyone being on the same page with that educational piece is such a critical piece of it.
It really is. And that line, if for any parents who are listening, that one line, they're going to grow out of it. They're going to grow out of it. Follow your mom gut. Follow your mom gut, because if it is a tethered oral tissue, something else, they're not going to grow out of it. I have an 18-year-old living in my house, and there's research. I have personal experience in addition to all this research now that you can look up, use your internet. There's just so much information out there. Find that correlation and collaborate with your professionals. And if you don't have a myofunctional therapist in your area, there are a lot of myofunctional therapists who see clients virtually. And a lot of us are listed on airway-circle.com. But, they don't teach us this in school. They don't teach us this in hygiene school and dental school. And I just took another webinar the other day, and I think it was a 4-hour course in one of the medical professions. And I'm not going to say which one it is, but it was just a shock to the system. We need to get this word out more, because no one needs to suffer. And why do we need to continue to slap medication as a Band-Aid on the symptom when we should really find the root cause? And that's what we're here for. We want to find the root cause so that we can help you get better, feel better, do better, and have optimal health.
Absolutely. And that longevity of health, because we know that limited breathing decreases your lifespan because of all the things you just talked about. So informative, Angela. I'm so happy that you've always been brilliant, and always, you were doing local anesthesia before any of us in Virginia were. That's why you brought it back. And we were always like, ooh, what's it like? Tell us more about it. And so you're that leader for us in the VA and the Commonwealth. So I so appreciate you being with us today and sharing this. And you all, it'll be in the show notes as well. Central Virginia OMT, also Airway Circle. Is that what you also said, Angela?
Correct.
Okay. To connect with other people, learn more. The Googles, the inner wide webs, the world wide webs is a big thing too to look into. So thank you for being a guest here with us, Angela.
Oh, I loved every minute, Kelly. Thank you.
It's such a delight. And for our viewers and listeners, if you wouldn't mind, do me a favor. Go to Apple and like us and subscribe to our podcast. That's the way that we improve and grow our numbers and subscribers. So I really appreciate that from that favor that you're doing for us. And you all rock out your day. Thanks for everything that you're doing. And thanks for listening. Be well.
Mwah.